Good morning, everybody. We are back. Thank you, everybody, for commenting. Um, I realize many of y'all cannot attend live. And so, as long as you comment and let me know that you still want me to do these QRA lives, I will continue to do them. So, thank you. But if nobody shows up or nobody comments, then I'm okay just stopping these. But thank you. So, for those of y'all tuning in, um, let me just get the chat going. Type into the chat while I'm waiting for everybody to sign in and log in. This is QRA Live, so quick restorative acupressure. I do this every Sunday, 8 a.m. Central Standard Time. If this is your first time joining, make sure you hit the subscribe button so you get the notification that I am going live. And so you can ask about what's the purpose of this? This is a way for me to help people all around the world because we have subscribers and followers that are all around the world and they can't come to our clinic. So I'm like, okay, what's another way that I can help them? So this is my way, besides the reels, the videos that I, record on YouTube, to give the information that we provide for our patients in our clinic. This is the other way. Good morning, Dolores. Thank you for joining again. The purpose of this is to help you give you the information. If there is a QRA, a quick restorative acupressure, I will show you, demonstrate it here live. So type into the chat what you need help with, what are you struggling with? What health concern are you struggling with? And I can, show you, give you information about which providers to seek, what to ask them, what to look for. This is all based on um, my team treating patients live right now. This is not a channel where we go and research. We go to pubmed.com and then we start scrolling through research and we just regurgitate. We just tell you what's on the research. The information that we provide, that I provide on this channel is information that we are actually doing. Actually, it's strategies we're doing or recommending our patients right now. Right? We help thousands of patients every year, and so it's not theory based. So now, however, I do need to give you a disclaimer. Being on every information that I provide here, they have helped our patients get results, but I cannot say that you have to check with your physician before you do anything that I say on this channel. Okay. Otherwise, YouTube, Google will shut me down or shut this channel down. Okay. So yeah, as you log in, type into what you need help with, what health concerns are you struggling with, and I will, go through what you should be doing. This is not a quick fix channel. That's another thing I just want to also emphasize. There is no such thing as quick fix. If you've been around the world for at least 60 years, or even 50 years, you already know there is no quick fix. And everything that seems to be a quick fix actually causes more problems. It causes more problem. It doesn't fix anything, right? So even though my quick restorative acupressure is quick, it's not a quick fix. You need to fix the underlying conditions, underlying root causes. And that's the key about, fixing problems is underlying problems. Fixing underlying problems. What is underlying problems? And I'm just going to continue to go on this topic and until someone puts in something that they need help with. So to fix underlying problems, and what does that mean? What does it mean to fix a problem? To fix a problem, in my definition, everybody's definition is different. We have patients that come in and they're like, I just want you to fix it, and then we ask them, what do you mean by fix it? Oh, I just don't want to have this symptom. I don't want to have this pain. I want to have more energy. I want to lose weight. These are all symptoms. They're not underlying problems, right? They're not, we've had people come in and their physicians tell them, oh, if you just lose weight, then you won't have diabetes. You know, that's not always the case. Weight gain is not the cause of diabetes. Or if you just lose weight, you won't have high blood pressure. That's weight gain can make blood pressure and blood sugar worse, but it is not the cause. And so for me, coming back to what is actually fixing, some, here in the US, the pharmaceutical companies, the insurance companies brainwash the public to say, okay, fixing a problem is you no longer feel it, right? But you may be taking 10 medications to make sure you don't feel it. And you may be having a surgery every year, but but that fixes a problem, right? So to me, I'm not saying that's wrong. I'm not saying that's wrong. If that's what you believe, that's absolutely you're right. What I believe and what our team believes in fixing problems is that when you fixing a problem is where when your body is able to heal itself without other help, without a crutch. A crutch, when you break your leg, you need a crutch to walk, right? Well, you're not, everybody knows, wait, as long as you're using that crutch, you're not able to walk on your own 2 feet, right? But why do we not apply that to our health, to the rest of our health? That I don't understand, right? So a crutch is something, right, that assists you. It helps you to get back on your feet. But if a person, just think about this. If there's a person who forever, you see them every single day, they have to use a crutch to walk, right? Did they really fix their leg problem? The natural answer is no, right? It's so simple. We see people walking on crutches, we know there's something wrong with their leg and they didn't get it fixed. Whether they had surgery, they're taking pain medications, they're still using a crutch and it didn't fix it. We know that. But how come we don't apply that to every other thing? When we see people taking medications to maintain their blood pressure, their blood sugar, their hormones, these, thyroid hormones, these sex hormones, women taking birth control, when we see people taking these every single day, how come we don't see them as crutches, right? In my opinion, they're crutches because once you take them off, right, then everything goes at chaos. Like the person who's in crutches, you tell them to stop walking in crutches and they can't walk anymore because they didn't fix the root cause, which is their problem, right? Their leg is not fixed. Same thing. If they get off their blood pressure medications, does their blood pressure immediately shoot up? Well, that blood pressure medication is a crutch, right? Because you take it away, then everything comes back. Same thing. You take them away from birth control, women from birth control, and their hormones for some reason like, oh, now they're all out of whack. They're out of imbalance. They were always imbalanced. The birth control does not fix your hormone balance, right? And as women get, the most of our followers are, 50 years and older, they may be taking hormone replacement therapy. Just think about it. It's hormone replacement therapy. It's not hormone restoration therapy, right? So only, in my opinion, fixing a problem is only when you restore it. If you are replacing it, you are not fixing any problem. Now, I'm not saying there's, some of you, I know because of you've been told you need to have a hysterectomy, you need to remove your ovaries, as you get older because you don't need them. Big lie. And so all you need to do is it's just kind of funny. You don't need your ovaries, you don't need your uterus, you just need these pills, right? I don't know, that just doesn't make sense to me. It's like you don't need your organs, you just need to take pills, and then you'll be fine. That to me is not fixing a problem. Okay. So let's see, Dolores. I need to get back on my Mediterranean menus. Got to remember that sugar can do big damage. Yeah, absolutely. And I can not taking fruit juice, but finding the fresh fruit need some guidelines. Yeah, absolutely. Uh, so yeah, but I'll jump to that, Dolores. Let me just finish my point about fixing a problem. If you are relying upon something, and that could be even like we are in acupuncture in herbal medicine nutrition clinic, right? So even if someone is needs to get acupuncture in order, let's say, you know, they have to get regular, even on maintenance, they have to get weekly, acupuncture in order to maintain their blood pressure, their blood sugar, then acupuncture is a crutch. I'm not, if you may be thinking I'm hating on medication, okay, or I'm hating on Western medicine. I'm not. I just came back from Germany, and my sister and my brother-in-law, they're both Western medicine physicians, right? I love Western medicine. So don't get it wrong. So even if someone is, because there are many acupuncture clinics that also use acupuncture as a crutch for their patients. They don't fix the problem either. I'm not saying acupuncture fixes, every acupuncturist fixes people's problems. No, that's not the case. It doesn't. Some don't, right? Some acupuncturists are just focused on symptom relief for their patients. I'm not saying that's wrong, but I'm just talking about fixing problems right now. Fixing problem is we do acupuncture and then we stop the acupuncture and your body is able to maintain your blood pressure, your blood sugar, your hormones by itself. That is fixing a problem. Okay. And that's why in our clinic, I don't consider we do acupuncture. What we do is restorative acupuncture, acupuncture and Chinese medicine that restores function. Okay. Can acupuncture and Chinese medicine and nutrition and supplements be used as a crutch as well, even though they're natural? Absolutely. That's why I don't like, we have a lot of patients that go to other practitioners and they bring a bucket of supplements. I'm like, okay, that's no different than taking a medication. No different. Just because it's natural doesn't mean it's fixing the problem. Okay. So, all right, let me dive into some of the questions or so Dolores, not taking fruit juice, but finding that fresh fruit needs some guidelines. Yeah, fresh fruits are definitely the best. It is, I would say, the best way because it's not just what's in the fruit that's going to benefit you. It's the act of chewing, okay? Chewing, when you eat, is it, and I do protein shakes. Okay, not every day. I do protein shakes. Because I lift weights, but I do protein shakes, and so it's all liquid, right? And so you don't want to do that. You don't want to re use that to replace a meal. Like in the past, I forgot, in the past 10 years or so, a lot of weight loss programs out in the market, they were all focused on protein shakes, right? So to reduce calories, reduce the cravings and so forth. There was one mistake. There's one harm to protein shakes replacing your meals. It's the chewing action. The first part of your digestive system starts in your mouth. You're chewing. By chewing, you release digestive enzymes. You don't chew, you don't release them. This is why it's so important for you to chew, to eat fruits, not drink juice. Okay. Even with smoothies, I would never use a fruit smoothie to replace eating fruits. Nothing can replace that. Okay. So it's not just about the fruit itself with the fiber, which is important. What's more important is it's starting your digestive system. It's saying, hey, digestion, start, let's turn it on. The act of chewing turns it on. You don't do it, then you don't activate it. Now, how much, you didn't ask this question, Dolores, but I'm going to tell you anyways, how much should you chew? You should chew your food at least 20 to 25 times each time before you swallow. Here in the US, everything is so fast paced. Like when I went to Hamburg, Germany, everything was slow paced. Everything was like really slow, right? Uh, but coming back into here, the US, everybody's like, they're like, what we call it wolfing down our food, which basically means we don't chew. That's another reason why there's so many digestive problems here in the US. Like in Germany, I mentioned in the last week's QRA Live, it was hard for me to find an obese person. I mean, it was hard. I had to really pay attention. Maybe I saw one or two. Here in the US, it's so easy. Everywhere I look, right? Everywhere I look, there's obese people. And so that's because we're so fast paced. We don't sit down. We say we don't have time for our family. Well, that's because we rush. In the morning, we're rushing, we're grabbing things on the go, we're eating breakfast while we're driving instead of just waking an hour early to spend time with our kids, with our family, and just eat. Okay. So that's one thing about fruits. Okay. Joanna, Joanna, no worries. Thank you for being here. Dolores, I'm only taking cholesterol and BP meds at night and potassium in the morning. I don't like pills. Yeah. So Dolores, sometimes, as we, and this is, and I'm not saying this as a criticism, I'm saying this as a fact. When we do not when we do not do the right things and when we were younger, unfortunately, we damage our organs. And as we get older, we have no choice but to take pills. I'm not saying taking pills is bad, okay? There are situations where we get to a point where we damage our organs so much that we have to take pills to sustain our life for the rest of our life. That's a fact for some patients, okay? But depending on, where your organs functions are, there is a high possibility because in our clinic, we treat people, like I said, uh, I would say our average age is probably in 55. We specialize in helping the older generation, the baby boomers, Generation X. Um, so, we have patients that are in their 60s and 70s, and we're able to get them off their cholesterol medications, their blood pressure medications, their blood sugar medications. It's not too late if that's what you want. You may not want that, okay? But it is possible. But you need to go to someone who can assess your organ function and not just through blood. Blood work doesn't show everything, but blood work is important. We love blood work. But you also need someone whose solution, and how do you know? So the question you may ask, how do I know if that practitioner really helps restore organ function? Well, first you ask them, what's your treatment plan? Okay, you find out this is a problem. What's your treatment plan? Right? And if their treatment plan is not to eventually help you wean you off your medications, help to wean you off your supplements, they're not restorative. That's a very red flag right there. Okay. Now, again, this is only if you want to restore your organ function. Many people, I'm not saying this is wrong. Many people love to take medications. They love to stay on medications, and that's not wrong. That's not wrong. It's easy. It's easier. It's an easier way. I don't have to change what I eat. I just take a medication. I diabetes. I don't have to watch what I eat. I just inject insulin and then just drops my blood sugar. Hey, I'm not saying that's wrong. But if that's not what you want, then you need to find the right practitioner whose diagnostics are focused on organ function. If they're not focused on organ function, they're not restoring anything. They're going to give you something to replace. Okay. So even some practitioners, holistic practitioners, are saying, "Oh, it's in the mitochondria." Oh, that's the craze right now in functional medicine. Let's focus on your mitochondria. They're not wrong. But what is their solution? Their solution usually is to give you a pill, a supplement. Okay. In my opinion, that ain't fixing anything. Okay. Well, that's not restoring anything. Okay. So I hope that helps. Joanna, anxiety for my 18-year-old, new to University of Anxiety. Yeah. So anxiety, there's a lot of causes. So there's external causes, there's thought process causes, like how your daughter is thinking. Those all can cause. There's no one single thing, okay? Can there be a chemical cause? Absolutely. Chemical imbalance up here? Absolutely. Is that the only cause? No. It's never just a chemical imbalance. Never. Okay. It's the friends she hangs around, and it's how you parent as well. Okay. I know this is a little confronting, but I'm going to tell you the truth. That's what you get with me. Um, all of these matter. And I'm not a parent. I don't have kids, but I was a kid. Okay. So I know what it feels like to be parented. But parenting matters. The friends she hangs around matters. Her brain chemistry, it matters. Her food, it matters. So I will just talk about, when we don't treat a lot of kids, although 18-year-old is technically adult, we do treat a lot of adult anxiety, depression, fatigue. Those are the common ones. And so, uh, the way we treat it, okay, we can't help with the external things because that's external, like their home environment. We can't help with those, right? But we give recommendations, right? But one thing that I can tell you, Joanna, that you need to make sure your daughter is not doing dietary wise, that she is not drinking coffee. Okay, most people who have anxiety drink coffee. Um, she's not on any type of stimulants, caffeine stimulants, energy drinks, right? A lot of people with anxiety are fatigued. So make sure she's not doing any stimulants. That's caffeine, right? Which is in coffee, which is in some people are super sensitive even to tea caffeine. So coffee, energy drinks, you need to get her off of those. Um, they are making her worse. When you get her off of it, I don't know if she's taking those. When you're getting her off of those, she ain't gonna like it initially, but it will help her. Okay. Sugar is a stimulant. You need to get her off of all types of sugar. Processed sugar is a given. Like high fructose corn syrup, you got to get her off of that. Okay. Uh, you have to also get her off of simple carbs. So sugar, when I say sugar, I'm talking about the white stuff, white rice, white bread, white potato, white noodle, right? You got to get her off of those. So those are basics because those make absolutely 100% make anxiety worse. Okay. And then also you need to get her to go out and walk more. Walk with her. Don't let her do it by herself. Walk with her. That's the time you can spend time with her. That's one thing we don't do here in the US. I think, Joanna, I don't know, are you from Canada or from Australia? I forgot. But like going to Germany, it's similar. It's almost like Asia. In Asia, we walk everywhere. It's a way of living. It's not exercise. It's a way of living. Um, and in Germany, they don't have motorcycles and they do bicycle. I mean, they have motorcycles, but I don't know, maybe it's the culture. Most people ride bicycles everywhere, which is so cool. So they are exercise. That's like my brother-in-law, he's a urologist surgeon, and he works in a very famous one in Germany, and he rides his bike to work to his clinic every day. I mean, they have a car, but they barely use it. Like when they were Canada, okay, yeah, that's what I thought, Canada, Joanna. So they ride their bike. That is the way of living. So in Canada, I think Canada has good parts of Canada have good public transportation. So get her out and walk, right? Walking will change the brain chemistry. Just walking, right? Get out and walk. So just the, you'll be surprised. Simple changes in our daily habits can make, I like to say, little hinges swing big doors. You see that big door back there? You know the hinges that, to attach the door onto the frame? How big are those hinges? They're this big. How big is that door? Huge, right? Little hinges swing big doors, which that means little changes in your life can create big impacts. So even though you've probably heard from other people, just go out and exercise, go out and eat right. Well, guess what? If you actually do that, you wouldn't need half of the medications, or especially here in the US, we would not have half of the chronic disorders that we have. The US consumes the most medications in any country in the world. That's why we're so sick. Okay. All right. So hopefully that helps. Good morning, Anna. Good to see you again. Wondering, besides massaging my hands, knuckles for arthritis, is there anything else I can do to relieve pain and swelling? Absolutely. There's so many things, Anna, you can do. Um, if you're talking about things you can do at home, yes, there is. So if you have arthritis, okay, and now it depends what type of arthritis you have, Anna. Arthritis could be osteoarthritis, which is a degenerative. It's called a wear and tear, which means I use it a lot and then I'm getting wear and tear, like your car tires, right? The more you use your car tires, the wear it wears down. That's the same with your joints. That's osteoarthritis. There's the other one, rheumatoid arthritis, which is it's a blah, 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 an autoimmune. It's where your body attacks its joints, right? So it depends on what arthritis you have, Anna, but I'm assuming most people have osteodegenerative. So if you have osteoarthritis, the cushion within your joints, it's pretty much gone. And there ain't right now, there's not anything that's going to regenerate it. Okay. Not even stem cell. Stem cell only works if you still have cartilage there, if you still have cells to regenerate, right? But if you don't, then stem cell is not going to work. It's not going to be permanent. It's definitely not going to fix a problem. Stem cell is also just temporary. But for people who are bone on bone, that's a great, it's better than not being able to walk, right? If you're bone on bone, to you said relieve pain and swelling, you could do these injections called these cartilage injections. They work for 50% of the people. I used to have a medical team on my team, a physician and a nurse practitioner, and we were doing those injections. They're called Synvisc. The brand names are called Synvisc, and we haven't. I don't have the team anymore because it's temporary, and our clinic is focused on restoring function. Um, and I forgot what the other one, but the most popular one is called Synvisc. They basically inject the cartilage from a rooster's comb in between your joints. Mostly it's done in your knees. It can be done in your hips, and it just creates a little space. But that doesn't last. The patient that we saw that lasted the longest was 2 years, but typically it's 3 to 6 months, and then you need to get another injection, right? And insurance covers only a certain amount. If after that, then it gets pretty expensive. It could be, I think it was like $500 to $600 a shot. And then people start, thinking about stem cell, or what do they call it? There's another word for it. I forgot it. It's escaping my brain. But stem cell is usually what they call it. Stem cell, they're saying, oh, it can regenerate it. Yes and no. Yes and no. Can it last longer? Yes, absolutely, it can last longer. Um, but does it last forever? No, you still need to get stem cell injections. But if you're bone on bone, that may be your only option. It's because if you go to an orthopedic surgeon, they're going to say you need knee replacement, you need joint replacement, right? And joint replacement causes a whole batch of other problems, right? It may fix your knee, like you will have a good knee and you can walk again, but it's going to cause ankle pain, foot pain, hip pain, and then eventually back pain, and then mid back pain and the neck pain. They don't tell you all that, okay? Because they're only focused on that joint. So I'm just telling you all the progressions, what we've seen in our clinic from actual real life patients, right? Hopefully that helps, okay? All right, guys, just a couple more minutes and I need to leave. Sue, thank you for joining. Karen, I am on statins for high cholesterol. How can I get myself off this? I realize our bodies need cholesterol, so when it is considered dangerous to us. Yeah, Karen, that's a great question. High cholesterol, it depends on what is high. If you're taking statins for total cholesterol, first of all, I need to give you the disclaimer. Okay. Otherwise, YouTube is going to shut my channel down. I can't tell you what to do with medications. Okay. I'm not a physician, and I can't dispense medical advice. I will tell you if you were my family, if you were my wife or my sister, what I would do. And I will tell you what I have done, what my team has done for our patients. I will tell you, but it is not me telling you what to do with your medication. Okay. I know this is kind of the workaround, but I need to say that. So this is what we've done with our patients who want to get off their statins. Okay. So the statins, we look at our patients to see why they're on their statins. Here in the US, physicians like to give statin medications just to give it. If your total cholesterol is high, then they just give it to you. Okay. Um, but cholesterol, you are absolutely right. Our bodies need cholesterol. And there's more research that are saying that those cholesterol ranges are inaccurate, right? That to have certain higher cholesterol is actually a good thing because every single cell in our body needs cholesterol. Your hormones need cholesterol, right? Without cholesterol, you're not producing any hormones. So there's more and more research. I suspect in 10 years, they're going to change the cholesterol range. And so all those people that are taking cholesterol medications, even though their cholesterol was just a little elevated, man, they're going to start suing the doctors because cholesterol medications, especially statins, destroy your muscles. They destroy your muscles. They cause problems, a lot of problems, a lot of side effects of statins. Okay. Some of them with their joints as well. So what we do with our patients in our clinic is we see which one. The most, I would say, dangerous is your triglycerides. That is the one you need to pay attention to. Then it comes to the VLDLs and then the LDLs. Okay. They're not good or bad. It's not good or bad cholesterol. They're just, low density. These you want to pay attention to more than your total cholesterol. They'll say your total cholesterol needs to be below 200. Well, some people's total cholesterol is above 200, but it's because their high density lipoproteins are super elevated. So that doesn't mean they have a cholesterol problem. They shouldn't be on statins, right? And so it depends. So I would say if your triglycerides, the triglycerides are the worst ones because they're sticky suckers. Those are the ones that stick to your arteries. Those are the ones you need to worry about. And triglycerides, elevated triglycerides is because of a liver dysfunction. And guess what statins do? They damage your liver as well. So even though statins are supposed to lower your cholesterol, the side effect is they can raise it too. So you need to find someone who can actually look at your organ functions and see and help you restore the functions. So Karen, the short answer is if you want to get off your statins, you need most I can pretty much just based on the thousands of patients we treated, I'm pretty much certain your liver is damaged. Okay. But there's other organs that are damaged that are causing your cholesterol to be elevated. Now, this is assuming you're eating the right things. If you're eating a lot of sugar, people think it's about fat that raises your cholesterol. No, 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 no. It's sugar that raises your cholesterol. Okay. So you need someone who's saying the same things I'm saying. If they're not saying the same things, they're not going to help you restore your function and get you off your statin medication. Hope that helps, Karen. Okay. All right, guys. Thank you. Last one. Joanna, do you believe in grounding mat sheets? I will say I believe in grounding, okay? Because if you look at the earth, why do we not all just fall off the earth? Okay? Because there is gravity. Gravity changes, the you can say electromagnetic, I would say the ions, right, in our body. So they're definitely, whether you want to believe it or not, it's a fact. Okay. So I believe in grounding. Grounding helps us balance our ions. Okay. Now, do the grounding mats work just as grounding? I don't know. Grounding is just going barefoot onto the ground. Okay. In the dirt. All right. Not artificial dirt, not artificial grass, but just getting in the ground. Like that's why I hear people go to Alaska because Alaska, the ground is not changed. It's not, like Dubai, it's artificial. They bring in dirt from other places to make islands, artificial islands, right? And so that's not grounding. Grounding is going to pure land, right, in the nature. That absolutely I agree with because that's just a fact with gravity. Okay, so hope that helped, guys. Thank you for joining, guys. And yes. I will be back again next Sunday, 8 a.m. Central Standard Time. Make sure you jump in. Hey, I didn't do any QRA today, but I gave you information about what we do with our patients, and hopefully that will help. My goal is to help you find the right practitioners so that if you want restorative health, you want to restore your function. My goal is to help you find the right practitioners. If you can't come to Austin to our clinic and my team, I'm hopefully I can help you find the right practitioners and ask the right questions. When you ask the right questions to your providers, that will tell you if you have the right provider or not. Because if your provider gets defensive when you ask these questions, 100% you need to leave. They're not there to help you. Okay. It's sad. Unfortunately, this is nothing to do with what country you're in. I went to Taiwan to help my dad. And I was talking to an orthopedic. This is at one of the famous hospitals. I was talking to the orthopedic surgeon um, about my dad, and I was talking about, okay, did you do these labs? Did you do these tests? And he's like, that's not my field. I only talk, if you have a question, you can only ask me questions about bones. I'm like, okay. I took my dad and said, hey, we're not seeing this orthopedic anymore. He didn't care about you. Okay. So it doesn't matter what country you're in. So this is how you find the right practitioner for you. All right, guys. Thank you for joining in. Have a great Sunday. God bless.